This is In Depth. The days are growing darker as the winter approaches. The surge of COVID is making an encore appearance. Hospitals, including those in the tri-state, are near capacity, and governors are tightening up restrictions. Well, earlier tonight, I talked to our health contributor, Dr. Payal Patel Davladabadi. She's an associate professor of public health at the University of Evansville. Good to see you tonight, Dr. Payal. Are you surprised by this surge that appears to be growing?
Brad, not at all. This was actually kind of expected, given that temperatures would be getting cooler. We would have lower humidity. Viruses typically thrive in this type of weather. People are gathering more inside, and people are getting tired. They want to be around one another, so they're kind of lessening on the precautions. So no, this was really expected, this surge during this time in fall and winter, and so hopefully we can kind of keep the numbers down going forward in the next few months.
And that brings me to pandemic fatigue. It's for real for millions of Americans, and it affects all of us in some way. How do you get past that?
Brad, COVID for many people has become part of their daily life, and I understand many are tired, many are experiencing that fatigue, but we have to remember that we all have to work together on this, keeping friends, family, loved ones safe, and we just have to stick together until COVID kind of subsides and until a vaccine is developed and mass distributed.
Thanksgiving and Christmas, it's estimated about half of Americans are heading over the river and through the woods to be with family. How much of a risk are they taking, and what would you advise?
The CDC has actually recommended people to not travel for Thanksgiving. Typically, COVID spreads rapidly when multiple families get together under one roof, and especially if families are visiting others who are of a high-risk category or who are elderly, they can experience extremely high-risk complications. And so it is advised to not travel over Thanksgiving just to minimize spread and also minimize the number of severe COVID cases that we could see.
And the spread of COVID is no longer a big city problem. It's becoming a small town crisis now. Why is that?
Well, typically those who live in rural areas, for the most part, are older, and they typically experience more health issues compared to other populations. And so also in rural areas, there's usually a lack of access to healthcare or minimal healthcare resources. So when you combine all of these factors, and then you add a pandemic on top of it, add a highly infectious disease like COVID, on top of all of that, we really see those in rural areas, those in small towns, really bearing that brunt of the disease.
Well, dining outside has been one way to mitigate contracting COVID in recent months, but that is obviously getting harder with winter setting in. One tool we're seeing all over the country are those so-called plastic igloos, the tents, but they are relatively small with limited seating. How safe is that?
Not too safe. The igloos, those tents, you're really just taking an indoor setting and putting it outside just because it is enclosed. There's really not much ventilation, so it's really an indoor setting, but it's outside. If you're going dining in your COVID bubble, people that you know, that's part of your COVID bubble, yes, it's fine, but just dining thinking that it's a safer alternative than dining indoors it's not true.
Well, the vaccine, how difficult will it be to distribute it, and soon will we see? How soon will we see those shots?
Indiana, Kentucky, many states will see them here in a few months, but most states have distribution plans. So the vaccines will go to the frontline workers first, those in the healthcare industry who are on the front lines treating COVID patients. And then the vaccines will go to the elderly, the high-risk populations, and then lastly, it will be distributed to the general population. The general population may not see the vaccine until late summer of next year.
And Eli Lilly's antibody treatment, that's important, especially considering what hospitals are facing nearing capacity. And we've had some doses right here in the Evansville area. How important is that in the interim between now and when we'll get a vaccine?
It is very important. FDA granted emergency authorization of that. It is used to treat mild to moderate cases of COVID that could lead to high-risk complications in children and the elderly. However, there have been shortages of that antibody treatment, and so physicians will have to make some difficult decisions regarding that, just so the treatment is allocated to the highest risk patients.
You know, it's like a tug of war, obviously, Dr. Pyle. We've been facing this all year, and it is basically the economy that's affected by this, and basically the economy, if we are not careful, going out to businesses, whether it be to a retail outlet or a restaurant, that affects the health issue here. What do you tell small businesses facing tighter restrictions, that small business that is facing just closing up shop for good?
You know, it's been hard for everyone, but it has really been hard for those small businesses. Hang in there. I know many small businesses are trying to be as creative as possible to restore their business during the COVID pandemic. So thinking of creative, unique ideas. I know, social media has been a huge played a huge role in maintaining customers with small businesses. So trying to be creative, thinking out of the box, and just remembering it is a hard time, but COVID will subside, and hopefully everything will get back to somewhat of a normal.
Well, Dr. Pyle Patel Davladabadi, thank you so much. You and your family, please stay safe, and we'll be talking to you soon.
Thank you, Brad.
Eyewitness News at 9 returns.